So infection in eye is a risk not worth taking. So today I'll be talking about the infection control. It is the process by which a hospital, a healthcare develop and implement specific policies and procedure to prevent it. Now here please note that don't copy paste. Make your own policies, make your own procedures, write it yourself. The components of this are basic measures which you will take for infection control, education and training of your staff, protection of your healthcare workers, for example, by immunization, identification of hazards, and minimizing the risk. Please note here, educate, educate, educate. Train your staff, because if you don't want your patient to lose vision, and if as a surgeon you don't want to lose your dignity and reputation of your lifetime, educate and train your staff. Then routine practices, aseptic technique, use of single-use devices, antibiotic usage, and sound management of medical waste. We have a lot of talk about single-use device in the discussion. My take here is hollow tubes are difficult to clean. Disposable cannulas are worth investing in. Disposable single-use devices are worth investing in. Then coming to surveillance. Surveillance is a very important part of infection control program. Incident monitoring, outbreak investigations are again a very important part. Please note that incident reporting in any hospital and its CAPA. CAPA is corrective action and preventive action is must for any hospital. Then we coming to the hospital administrator should always form an infection control committee. Now here please note that infection control committee is a very, very important part in controlling your infection. So they should understand that this is not a meeting for come eating and having a tea. It should be a team who is committed for infection control. This is a very important slide because there is so much confusion who can be the members of this committee. Ophthalmologist, microbiologist, or anyone from administrator. Then representative from CSSD, food service, laundry, laboratory, pharmacy can be a part of it. Here to add on, we have so many questions that we are only a 5 people organization or 10 people organization. Now what to do? So an ophthalmologist and a person who is having any degree, either a nurse or a OT assistant who is having a degree can be a member of this committee. Then task of this committee, they have to make a yearly program as well as review them. Surveillance have to be done by them. Again, training is a very important part. Development of policies. Here to add on, developing a policy is okay, but implementing is equally important as a developing of the policies. Then food handling, laundry handling, cleaning procedures, visitation policies, direct patient care practices. Another important data is that they have to manage the critical bacteriological data and the outbreaks of any infection and prevent infections. Infection control manual has to be prepared by the infection control committee or their team and it should be readily available for healthcare workers. Again, I have emphasized on education on training of healthcare workers. The healthcare workers or staff should be equipped with requisite knowledge, skills, and attitudes for good infection control practices. We should always assess their training needs, organize their training, and periodic retraining. Core strategies are of hand hygiene, isolation and standard precautions, ensure clean environment, cleaning, disinfection and sterilization of instruments, then antimicrobial usage, food and water precautions. Here, I like to add that cleaning of instrument is as critical step as autoclaving. Autoclaved, uncleaned instruments are considered to be unsterile, as debris prevent them to sterile. Then this has been covered a lot by Dr. Nirmal sir, but just I'll add on to 2-3 slides that ophthalmology comes in a B category. Crisscross of patient flow has to be avoided. It should be preferably on the top floor. And what we do by differentially decreasing the positive pressure ventilation gradient from inner to outer zone, what are we doing? Bacteriological count is progressively decreasing from the outer to inner zone. Then these zones have been explained by sir. We have the zoning is must in an ophthalmology: outer zone, clean zone, aseptic zone, and disposal zone. HEPA filters, what they do? They reduce the fine airborne particles which may harbor bacteria and viruses, thus reduce the risk of airborne microorganism transmission, hence play vital role in maintaining the indoor air quality. Then CSSD, a buzzer system should be there after completion of operation from OT. This has been again covered by sir about the CSSD, traffic in OT, dress code. And hand hygiene, single most important factor for prevention of hospital-acquired infection. Water taps should have filters. Elbow or foot or sensor operated at least 10 centimeter above the wash basin with continuous and adequate supply of water. Please note, treat water at the user end. Then high quality unidirectional flow of air towards the main entrance along with efficient ventilation control, and there should be a separate AHU must be installed in each OT. About the sterilization, the major source of infection in eye surgeries are the very instruments used in the surgery, and proper cleaning, as I have already told, is of utmost importance. And what I told before also was inefficient sterilization is due to rusting and stains and irregular surfaces. So properly scrutinize the instrument for any defects, debris, prevent them from drying of tissue or blood or viscoelastics, and at the end of the operation, clean them. And cannulated instrument, please note, cannulated instrument should be flushed at the point of use, and in CSSD, immediately wash under running water and clean by 4-ball technique or ultrasound cleaner. Thorough cleaning to remove debris by toothbrush should be done. In ultrasonic cleaner, high frequency sound waves dislodge adhering tissue particles. The instrument should be dried by aeration, and please note, no moisture should be left prior to sterilization. Surgical instrument should be sterilized after every case. Please note, One surgery per instrument has to be done. And once opened, set should be considered as contaminated. Proper record of each and every step of sterilization process should be maintained. Please note, documentation is equally important as doing the procedure. As in court of law, not documented is not done. About these sterilizers, autoclaves, vertical strict no. Flash should not be used in routine cases, not for your convenience and not for as an alternative. Horizontal autoclaves and that too preferably with a vacuum pump should be used. Class B autoclaves should be used. ETO can be done for vitroretinal instruments, but aeration period of minimum 72 hours is must. Then indicators. There are two types of indicators. We all know that chemical and biological indicators are there, but they should be placed at the most difficult location. These are the class 1 to class 6 indicators. Class 1 are the process indicators, and going to class 6, which are cycle verification indicators. Now, cleaning of the OT, wet mopping with 2 to 3 bucket system using 1% freshly prepared sodium hypochlorite solution should be done. Other agents like Bacilloid, EcoShield or D125 may be used. Daily UV radiation for 12 to 16 hours is recommended, but should be switched off 2 hours before entering the OT. Microscope cleaning should be done 15% cetrimide solution. Lenses should be weekly cleaned with a lens cleaning solution. Microscope knobs have to be autoclaved, and microscope head daily cleaning with 0.1% ethanol. Tables and surgeon's seat can be cleaned with a 1% sodium hypochlorite solutions. Lights inside the OT once a week wiped with disinfectants, and OT walls, trolleys with weekly detergent washing. AC weekly detergent cleaning of filters and every 3 month service. Surveillance is the utmost important of the operating room. Goal of surveillance is to prevent surgical site infection, continuous monitoring of sterilization and disinfection. Then material used for surveillance are liquid media like brain heart infusion, solid media like blood agar, chocolate agar, and biomonitors are for steam process like Bacillus subtilis spores. Samples should be collected during first hour by trained staff. Swabs should be kept moist using liquid media. Note, air sampling can be done by using settle plate method. And interpretation is very made simple by AIS that 10 colonies per 10 centimeter of petri dish of bacteria are to be taken significant, but single fungal colony on plate should be considered significant. Please note, most important instrument in surgical center is an autoclave. It is important to buy a good autoclave. Endophthalmitis is an avoidable complication. One of the measures is by upgrading your autoclave. Worth investing in autoclave. Thank you for your patience.